Hi, this is Dr. Tristan, and I'm going to run you through what to expect on your first consultation. So your first consultation will be 45 minutes long. If you need a follow-up, that will be 30 minutes long. So on your initial consultation, we'll do a history taking, which is basically we're chatting. So you tell me what happened, when it happened, and why do you think it happened. After that, we'll do the assessment. So I assess, I don't guess. So we'll do blood pressure check, we'll do cranial nerve check, we'll do peripheral neurological examination, which is a fancy way of just saying if there's any weird nervy things, we'll test that out. We'll do orthopedic tests and biomechanical assessment as well, just to see what's happening. If I put you in this position, is that sore? If I put you in that position, is that better? Does this move? Does that move? And we just get a complete picture of what exactly is going on. After that, I'll give you a diagnosis. So what is a diagnosis? It could be this, it could be that, but most likely it's this. And therefore, this is the treatment plan that I suggest. And I'll quickly run you through the treatment plan, especially if you're a newbie to chiropractic, just run you through everything, what to expect. And for example, if I say, listen, I'd really like to needle this muscle, and you go, oh, I don't like needles, then we work around it. We change the approach. There's so many tools in the toolbox at the end of the day. When you leave here, I'd like you to know what happened, why it happened, and how can you prevent that from happening in the future. At the end of the day, I want to educate and empower you really to need me less and less at the end of the day, because I always tell my patients, it's great to see you, but I'd rather have you out on the promenade running or hiking on the mountain or swimming in the ocean than having you in the practice. So, after that, if you need some stretches or exercises, or I want you to put heat on it, or maybe look into some medication if it's really bad, we'll have a quick chat and then off you go. If there's something else, if you go up hiking Lion's Head and you sprain your ankle and it's completely unrelated to why you came in here in the first place, I'm happy to help. Pop me a message, go, Tristan, this is what happened. You're my patient now. You pay for my expertise, my knowledge, and having access to me at the end of the day. So I expect you to tell me, listen, this happened, what do you think? And I'll go, listen, that's really bad, I need you to go to the emergency room, or you know what, that's fine, just do this or that, or you know what, give it a few days and come in and let's assess and let's see what's going on. Things to not expect. Okay, things that I'm definitely not gonna do is, I don't like this endless follow-up cycle where you just keep coming once a week, twice a week, I don't know. That's just nonsense. There's no such thing as maintenance or alignment or correction or postural correction or anything like that. Okay, so yes, I do the adjustments or the manipulation, the clicking, but that is one thing out of so many things that a chiropractor can do for you. So if you just want to be clicked, if you want party tricks, go to a clown instead. I'm a health professional. There's so many things I could and should be doing, whether it's ergonomics, whether it's lifestyle advice, whether it's exercise, and all those beautiful things. So at the end of the day, that's out. I'm not going to try and convince you that there's something inherently wrong with your body and that I am the answer to all that. No. I believe that movement is the greatest thing. I think the more you move, the less you need me. So my job is to get your pain down and get you feeling more confident and comfortable in moving, because once that happens, you're way more likely to go exercise and do the things, and that is going to keep you pain-free much longer than any chiro, physio, bio, you name it. Alright, so if that's that, if you've got any other questions, queries or concerns, please feel free to reach out to me. We have that WhatsApp line, as I mentioned. I might not reply in that moment, there will be an automatic reply, but once I have a moment, I will reply to it personally and answer any and all questions, hopefully. Otherwise, keep moving, stay active.